what sports slash activities should we stay away from as much as possible?
The outdoors is ideal. Being as close to isolation is ideal. If you're going to be participating with a team, as much as we can keep you with your team members and therefore try and get to that idea of a cohort, have you working on drills that are skills drills that are more separated rather than close contact, and really trying to minimize as much as possible close contact competition. Now, you can turn on TV on Saturday and Sunday and see there's plenty of close contact competition going on. And I speak of American football, but nonetheless, you also see coaches and many participants on the sidelines wearing masks when they can. There's a lot of gray areas here, but as we know, masking is effective. So is hand sanitizing. Incorporating masking, hand sanitizing, distancing where we can, even during athletic competition, likely will help us. And Kip hit on a good point. There's an opportunity here for all of us to lead. It's easy to be a naysayer, but it's not always easy to stand on principle and say, hey, these things do work. But I would encourage each of you to lead and say, hey, hand washing does work, distancing does work, masking does work. None of it's infallible, but every little bit helps us. And in terms of athletic participation, I'm not saying that athletic participation shouldn't happen, but even the little things that we can do, Quinten, when we're competing and participating in athletics, probably help us right now. Keep that in mind. And as Kip said, be willing to lead. It's not always easy, but be willing to do it.
If you have had COVID, is there anything you need to do or you think would be a good precaution before that person returned to sports?
Lizzy, that's a phenomenal question. And I would ask you all to please continue to listen carefully to this answer, because I think it's a good one. And it's one that, Lizzy, we researched in our group probably 8 weeks ago, because this question was coming up and hey, lo and behold, we didn't know the answer. And this is not an ironclad answer, because these things change as we learn more about the virus and the illness. But at present, our group thinks that the American Academy of Pediatrics has outlined this pretty well in a well thought out position statement. And they state the following: that if you've had COVID or COVID related symptoms, that you should be symptom free for 14 days before you engage in a graduated return to sports participation. And they outline a loosely defined 1 week period for return to athletic participation full go. This protocol includes an evaluation by your regular physician at the 14-day mark to make certain that indeed you are non-symptomatic, that you are doing well, and in particular that you're not having any issues with your heart, that is, any cardiac issues. We know that one of the downstream effects of this COVID-related illness is something we call endocarditis, which is an inflammation of the heart. It can go fairly undetected and can be a silent problem. And the reason for that visit with a physician at 14 days is really to make certain that a young athlete is not having any cardiac issues that warrant further investigation or workup. So again, in brief, in summary, American Academy of Pediatrics, a 14-day symptom-free window after conclusion of symptoms. That's a little bit longer than what we've talked about in terms of returning to school or returning to work. But again, we're talking about athletics here. So 14 days symptom-free, an evaluation by your physician to make certain you're not having COVID-related issues, particularly with your cardiovascular system, and then a 7-day graduated return to sport. So in short, returning to full athletic participation, we think, should take about 21 days for people of your age. That may change in the future. We may find that that's too conservative an approach, but at this time, we'd rather err on the side of being conservative rather than being cavalier. So with that, I'll open it up to anybody else who might have comments from our panel.
just knowing what the IHSAA mandate or has recommended is that you do see a physician. So what our recommendation is definitely more than what's happening, I think, out there. And so basically making sure that you as athletes, you know yourselves and you know if you're struggling, if you've had this, if you've had COVID, you've been considered positive, and you're struggling or having issues, be honest with yourself and be honest with your athletic trainer, because you need to report those symptoms, because if you're having issues and you don't let anybody know, we can't help you. And so what we don't want is we want to prevent any type of emergencies that may happen down the road when we're on the field or we're on the court together. And that's our worst, that's our worst case scenario is an athlete collapsing on the court for cardiac reasons. And so that's something that we want to make sure that that you're making sure that you're right and you know yourself well, and making sure that if there's any red flags that you have with your own health, please let us know, and please let your physicians know so we can make sure you're safe as you return to sport.